Hello everyone and welcome to today's webinar. It is past, so I'm going to get started. So I just want to welcome everybody to our Spotlight on Health and Social Care Careers webinar. Before we begin, I just want to cover the housekeeping. So the session today is being recorded and will be available on demand on our HMY Careers Hub website. To help with the smooth running of the session, we have disabled delegates' videos and microphones. And if you have any questions during the session, please pop them in the chat box and we will try to answer them in the chat or at the end of the session. So in today's session, we're going to have an introduction to health and care careers, and we're going to hear from some of our professionals about their career pathways into the role. So before we get started, just introduce myself. My name is Tina Jenkinson and I work for the Humber and North Yorkshire Health and Care Partnership as Careers and Employability Manager. So as I said, in today's session, we're going to have that introduction around health and care careers and find out about different career pathways. And that's really important for us as an organisation. So just a little bit about our health and care partnership. It comprises of NHS organisations, local councils, health and care providers, voluntary community and social enterprises as well. The partnership is one of 42 new integrated care systems which cover England, and they're set up to meet the health and care needs across an area, coordinate services and plan in a way that improves population health and reduces inequalities between different groups. So the purpose of an ICS is to bring partner organisations together to improve outcomes, tackle inequalities, enhance productivity and help the NHS support a broader social and economic development. So we work in our ICS across a geographical area of more than 1,500 square miles, and we serve a population of 1.7 million people, all with different health and care needs. Our area includes the cities of Hull and York and large rural areas across East Yorkshire, North Yorkshire and Northern Lincolnshire. So in order for us to meet the health and care needs of our population, we need to ensure that we have an appropriately skilled workforce reflective of the communities that we serve. So this is where my role comes in as the Careers and Employability Manager in developing our talent pipeline and inspiring and growing our future workforce. And one of the ways that I do this is by delivering these Spotlight on webinars just to showcase the range of careers available in the sector and highlight the variety of different routes that you can take to get into health and care. So in today's session, I just want to start by looking at our current workforce data so you can start to see the size and scale of our sector. So if we start by just asking the question, and feel free to pop your answers in the chat, how many GPs do you think we employ across Humber and North Yorkshire? I'll give you a couple of seconds to think about that. Okay, so we employ over 1,000 GPs right across Humber and North Yorkshire. So how many other clinical staff work in the sector, working in GP practices? I'll give everyone just a couple of seconds just to answer that one. There we go. So we have over 2,000 other clinical staff working in GP practices. How many admin and managers do you think we have working in GP practices? Again, feel free to pop your answer in the chat if you'd like. We have around 2,500 whole-time equivalent admin and managers working in GP practices right across Humber and North Yorkshire. And how many consultants do you think we employ across Humber and North Yorkshire? So we employ around 1,292 whole-time equivalent consultants. And how many registered nurses and midwives do you think we employ within secondary care? So we employ around 8,780 registered nurses and midwives, but we also have a further 7,385 unregistered clinical support staff working with them. And then we also have additional nurses working in our PCNs, their primary care networks too. So how many total staff do you think we employ within our hospitals across Humber and North Yorkshire? So we employ around 35,000 whole-time equivalent staff. But then if we add in our GP practices, that takes us to around 41,000, and we haven't even started to consider our social care colleagues yet. So how many people do you think work in adult social care across Humber and North Yorkshire? So we have around 45,000 whole-time equivalents working across adult social care in the region. So we're now up to around 86,000 whole-time equivalent health and care staff. But do we employ any others? So how many unpaid volunteers do you think we have within Humber and North Yorkshire? So we have somewhere in the region of 127,000 volunteers, which equates to around 5,500 whole-time equivalent employees. But we also have another 23,000 paid employees in the voluntary community and social enterprise sector. So that's now taking us to over 135,000 whole-time equivalent staff working across health and care in Humber and North Yorkshire. But it's not just about the number of staff we have, it's also about understanding the demographics. So what percentage of our healthcare teams do not require professional registration? So around 40% do not require professional registration. About 28% of our workforce is made up of admin staff, 22% of support staff, and most of these actually come from our local population, so they're living in the local community. And what percentage of our hospital staff are aged 55 and over, do you think? So around 18% of our hospital staff are over 55, with the average age of 44 years. And what is our adult social care staff turnover rate? This is currently quite high at 31%. We had around 4,000 plus vacancies in the last year. So there are still 4,000 vacancies still to be filled. So this is just a quick recap on the data that we've covered. I thought that would be interesting for you to see that on one page. So if we start to look forwards then and what our 5-year view of the future workforce looks like. So focused here on secondary care, anticipated demand and net growth by role. So the data is telling us that adult social care turnover across Humber and North Yorkshire is 7.5%. So that equates to around 594 whole-time equivalent vacancies. And this is in addition to the 583 vacancy growth we're requiring over the next 5 years. For allied health professions, the turnover is around 7.2%, which equates to around 185 vacancies. And in addition to that, we need an extra 152 allied health professionals over the next 5 years. And support to nursing and midwifery turnover is around 12%, which equates to around 732 vacancies. And again, that's in addition to the 564 growth required over the next 5 years. It's actually worth pointing out that these figures are in addition to the anticipated demand and do not include those that are maybe leaving the service that are already employed within the workforce. So therefore, we expect the number of whole-time equivalents to maintain at current levels and increase to meet anticipated demand is is likely to be a lot higher than what we've stated today. So as I mentioned, the adult nursing turnover is around 7.5%. So we do need an extra 583 people to grow our workforce in the next 5 years. Again, this is just another snapshot of the allied health profession, and looking, we're going to need at least another 152 allied health professionals coming into our workforce over the next 5 years. Again, just a quick snapshot of the support to nursing and midwifery. So we do need an extra 564 support staff coming into the sector over the next 5 years. We do have additional workforce shortage areas in admin, IT and help desk, and we are going to look at the full range of kind of job roles in health and care during this session. Obviously, we've just covered the secondary care data there. So if we look at the adult social care workforce data, we can see that if the adult social care workforce grows proportionally to the projected people aged 65 and over in the population, then the adult social care workforce will need to increase by 29%. And that means around an extra 14,500 posts will be needed by 2035. And that will take our adult social care workforce to around 63,000 by 2035. So at the moment, we don't have any nurses in adult social care under the age of 25. So I think that's quite interesting data there. We need to do more around attracting younger people who are registered nurses to work in social care. We do have a shortage of occupational therapists and occupational therapy assistants in adult social care. And we also have shortages of registered nurses. So of the 800 posts available, 100 are currently vacant. 6% of the adult social care workforce posts are vacant, and 12% of care worker posts in homes with nursing are vacant. So across Humber and North Yorkshire, we have around 4,000 vacancies that need to be filled in adult social care. So how can we get you into the sector? So there are many route ways into the health and care sector. Some of these I've tried to capture on screen. So they include things like T-levels, apprenticeships, traineeships, supported internships, work experience. Of course, there's the degree route as well. And of course, there's always the opportunity for direct employment too. So now we're going to explore some of the different job roles within the sector. So these are what we call our get-in job roles. So these are the sorts of jobs that you could do at the start of your career. You'll develop a good basic knowledge and skills to gain qualifications to start your career. So you can see on here, we've got things like people like caretakers, domestic assistants, drivers, housekeepers, linen services, receptionists, switchboard operators, catering assistants, healthcare assistants, care workers, porters, gardeners and ground staff. So you can see there is a huge variety of different roles at our get-in level, and definitely would say that I think there's a career for everyone in health and care. So let's hear from some of our employees who are working in the sector. I've just stopped sharing my screen for a moment because I don't know if anybody's having any issues in seeing the videos. So I'm just going to try and reshare the screen to make sure that everyone can see the videos there. So I'll just continue on to the next video now.
My name's Will, I'm a healthcare assistant and I work at Glendevon Medical Centre in Teignmouth. Normal days, taking blood pressures, testing INRs. We do the diagnostic tests for doctors. So they request them and then send them to us, we'll do the tests and the doctor will interpret the results.
As a clinical support worker, one of my roles and responsibilities is to care for patients on a day-to-day basis, assisting them with personal cleansing, toileting needs, and being able to feed them.
Clinical support workers are essential to the running of the NHS. They support the nurses, they support the doctors, and it is a really rewarding career because you, especially in primary care, you're seeing patients regularly, you get to know them, you build a professional relationship, and it is really nice. In a hospital, it's slightly different. You don't tend to see the same people all the time, but it's equally as rewarding.
Working as a clinical support worker, it's very challenging, but the opportunity to meet new people, hear stories, and giving them a step to a better life, that's a satisfaction that no other job can offer.
You're definitely part of a community, especially when you're working in small towns like this. You get to know your patients, first name basis. It's different to working anywhere else. If you want to do this job and be a clinical support worker, your heart's got to be in it. That's the main thing. It's not the easiest job in the world. It is demanding at times, but stick it out and it is worth it in the long run.
If I can describe my role in one word, I would say it's fulfilling.
So my name's Keely and I work for the NHS Talking Therapies as an administrator. Based on my qualifications and previous experience, there was a job going within the NHS for the administrator and I applied for that. And obviously looking at the perks from the NHS as well as what they were looking for staff-wise that matched my personality, and that was how I got into that. So a lot of it is answering the phone to vulnerable patients who are either trying to refer into the service or who are already with the service, booking appointments for the therapists, or if anybody's poorly or needs cancellations or anything, we ring the patients and do that as well, sending out the appointment letters. I'd say it's quite rewarding as far as a career goes. Obviously our office itself and who I work with are very friendly, approachable, and make the day go a lot easier. But it's quite rewarding as well, even though people are ringing and they're quite vulnerable. When you're talking to them, knowing that you've put them in touch with somebody that can help. So obviously it's taking that on, making sure that it's all confidential, making sure that you're compassionate and things like that to the patient, but then noting that and making sure the therapist has all the notes and everything in the background. But yeah, it's just nice to know that you've been a part of helping somebody. It's nice around here. It's very pretty. We overlook the Abbey, so obviously you've still got the view. You're never too far away from anything. We can still go to Greggs for lunch. And then we're not too far from the moors and stuff like that as well. Quite a lot of the communities around this area are very close-knit as well. So yeah, well, I enjoy living here. Go for it. It's not one of the jobs within the NHS where you have to have a degree or anything else like that, and you can still progress quite quickly. Your day will fly by, no 2 days are the same. I would say if you were ever thinking about it, it's probably one of the best parts. Well, for me, I would say it's one of the best parts of the NHS to work with. MedShed.
So they were just some examples of jobs that you could do at the start of your career. So as you gain more experience, you'll be able to do a variety of tasks with little guidance or supervision. And you'll be able to do other types of jobs, which are our get-on level. And these are some of the examples of some of those jobs. So we have painters and decorators, electricians, plumbers, finance assistants, we have nurse associates, call handlers, emergency care assistants, medical secretaries, team leaders, chefs, and rehabilitation workers, just to name a few. So if we move on now to hear from some of those people who are working at that level, and just find out what it's like in their area of work.
So I've sort of moved around different jobs, different fields of work, and never found anything that I really hit and stuck at. So my first child was born and I thought, I want a job that if they're asked in school, what does your mum or dad do, they could answer and be proud with their answer. I have worked my way around, so I have been a care assistant. I was promoted through within a care home that I was in for 6 years, from a carer to a senior team leader, deputy manager. I am responsible for applying for care packages, recruiting my own staffing team, ensuring that their trainings are up to date, and monitoring that the service is running efficiently. As we stand now, I'm really happy where I am. In my current job role is that I'm home to have tea with my family, and that I'm able to spend time with my kids. So I think that is the biggest benefit, and it's a really rewarding job. It's how rewarding it feels that you've enabled that person to remain in their own home, or you've given mum or dad the best possible care you can in their final few days, and you've been that lifeline to families that are just struggling to manage on their own. There are some people that have never thought of care and they make the absolute best carers you could have asked for. They are the carers that are the first to arrive and they're the last to leave. They're the ones that will check on their days off how Mr. Smith is, just because when they saw them, they weren't feeling themselves, they weren't great or anything. It's one of those that you have to give it a try, and it gets rid of that thought of it's just making cups of tea for people. Choose care, change lives.
My name is William Payne. I work with the Community Dietitians as a dietetic assistant, and I work for Salford Royal NHS Foundation Trust. As a dietetic assistant, my main role is in nutritional support. So what I do is I go out and I see patients who are at risk of malnutrition. So we go out to their homes or the care settings, and we give advice on how people can best avoid malnutrition through changing their diet and their eating habits. I find clinical support a very, very rewarding career, and I found it both rewarding in the acute setting, especially on the wards. I found it rewarding in the outpatient setting as well, especially dealing with people who are obviously anxious and under a degree of stress coming into hospital, being able to reassure those people, make them feel at ease and make their time at the hospital far more enjoyable for them or less stressful. And in the community, again, going out to people's own homes where they're automatically more at ease, but it's about it's about empowering that patient. It's about giving them their information and giving them the knowledge that they need to improve things by themselves in their own homes. If you're thinking as for going into a career as a clinical support worker, I would say go for it, definitely. If you're hardworking, if you want to learn new things, if you want a challenge, if you want to make a difference to people's lives, then it's for you. If I could describe my role in one word, I suppose it'd have to be assist.
Thomas Lang, and my job title's recently changed. I'm Assistant Systems Analyst. I did an apprenticeship 2018 I started, and that lasted for just over a year. I previously was a carer for a family member, so it's sort of a logical jump, I would imagine, into the NHS. Yeah, I did that for a year and then I was taken on full time basically. I've been here ever since. It's IT support, but it's probably not what people might think. It's not just fixing PCs and things like that. We all have our strengths within the group, but I tried, probably because I've got a caring background, I tried to look at it on a more patient-based. For instance, we do a lot of redirecting of results that have gone to the wrong place, merging of records, things that directly affect patients. So it's because we manage the IT, pathology IT systems, we have tasks like that come on the back of it. It's not just, you know, if someone's mouse isn't working or something like that. The part of the job I enjoy the most, I would say, is feeling like you've made a direct influence on care of a patient. If I relate it back to looking after my dad, waiting for a result for any longer than is necessary, you know, can be quite anxious for somebody. So to think that I've sped up that process and made them feel better is, I would say, I get the most satisfaction out of that. In terms of my career, I recently moved up within the team, so to speak, to a new position. I'm doing more project work, things like that. We are responsible for the GP ordering system. I've had a lot of involvement with that, and we're currently rebuilding that, which I've got a large role in, so I'm moving towards that area, really. I would encourage people to go into this. Find your own sort of niche. There's room for it. It doesn't have to be a scientist, as I'm proof of. I've got no degree in biochemistry or anything like that, but you can still find a place for yourself, yeah. Medshed.
So again, just a sample of the roles that we have available at this level. If you do wish to explore more, we've got over 100 different job roles on our careers pathways on the website. So what's the next level? So we've got our go further, so go far. So at this point, you will be an experienced, well-qualified professional and probably be responsible for managing others. And you'll be working with a high level of expertise and competence. So these are just some of the jobs that you could do. So we have estates manager, fire safety manager, office manager, nurse, occupational therapist, registered manager, paramedic, counsellor, doctor, and social worker. So let's go on to hear from some of those working at this level.
My name is Rose. I'm the Children's Community Lead Nurse here at St Andrew's Hospice. I've been a nurse for 35 years and I've done various aspects of nursing. And when about 6 or 7 years ago, I was doing some fundraising, and I decided to fundraise for my local hospice where I lived. And I realised they didn't actually have a hospice building and they were all working from an office, and I saw that the amazing work that they were doing, they did, and I decided to fundraise for them. So I did a series of challenges over the course of a year. And then when we relocated last year, I thought, you know what, I had a rethink about the time that I loved fundraising for the hospice, and thought, actually, that is what I'm ready to do and what I want to do. So amazing. It was more than, the families were much more in need than I'd initially thought, because lots of them don't necessarily have a lot of support outside, and the fact that we can come and support families when perhaps they are at their high, at their lowest, and we can go in and offer things that maybe they won't be able to do every day. There is no 2 days the same. You might come in a day and you think you're going out to visit a family, when actually that family say, actually my child is now unwell, and you might visit them, but you might have to go and visit them in hospital, or your family that you've had a new referral for a family that need your support that didn't before. So no 2 days are the same, no visits are the same, and that's what I love about it. It's just every day's a challenge. Having a good team around you is really key. And I think having interest in things outside of work is also good. It's a good stress reliever. Last year we recently opened our cinema. We've got a cinema here at the hospice, and one of the families came, and the parent was actually quite overwhelmed and said this is the first time that they've actually been able to bring their teenage child to a cinema to watch a film. It's something they've never been able to do as a family, and that felt quite proud to be part of that team. Going into palliative care is just something that can make such a massive difference to the lives of children and families that it's so rewarding, and definitely would do it. Whichever way you get into it, then it's definitely worth getting here. MedShed.
My name's Phil Darwick. I'm an operating department practitioner, and I work at Castle Hill and Hull Royal. I started out as a chef, and I was a chef for many years, working at Michelin star level. My first child was born by an emergency section, and I was inspired into the role. It was the care and the teamwork, that's what stood out to me. So I was inspired into that teamworking, that ethic, the work ethic. It has lived up to expectations, and it's better than I thought it would be. I think the variation, the day-to-day, it could be, you're working in different specialities, different areas, different patients, different needs, and different surgical procedures. So patients come into the anaesthetic room, it's about reassuring them, reducing anxiety, and then assisting with anaesthesia, or assisting on the surgical side, and even assisting in the post-anaesthetic care unit. I think the big challenge is when people have cardiac arrests on the actual operating table. A patient came in for a routine trauma procedure, and they ended up having a cardiac arrest due to the surgical intervention. So we basically had to put the patient to sleep and then use extra monitoring. And it's a bit of a rush, but one thing I did notice is the team. Everybody came together, other people came from other theatres to help you. You weren't left alone, so you were well supported. It's about how you deal with that and how you reflect upon that. And when you go home, you realise how important your life is, so you appreciate every single day. I don't regret any minute of it. There's plenty of opportunities in personal life and in your work life. There's plenty of development and CPD opportunities, and it's about pushing yourself. I think you should just do it.
So my name is Emmy, and I am a biomedical scientist in immunology. I completed a 4-year accredited biomedical science degree at Sheffield Hallam University, where I got the opportunity to partake in a 12-month NHS placement, which I did here in Hull. And here I gained my registration portfolio, which allowed me to apply for biomedical scientist jobs once I graduated, which is what I did, and that's how I got my job. Day to day, I come into the lab, I will have a rack of samples. I will prepare an analyzer, so I'll do some quality control, some maintenance, run the samples. I'll then get the results of those and enter them into our lab system, and those results will then go out to the doctors, nurses, consultants, anyone in the hospital that needs a result. I love learning about the analyzers, about the tests. what the results mean for the patient, what kind of, if it was a positive result or a negative result, or, you can see how the patient is improving or how the treatment is working. I would love to be a clinical scientist one day, which requires a lot more experience and a lot more work, but yeah, definitely a clinical scientist. Yeah, just making a difference with people's lives, in the sense of, the quicker we get a result out, the quicker they can, they're informed, and, their treatments might be different depending on the results. So if we see that, a month ago their result was this and now it's changed, it's really good for the patient, and getting that out as quick as possible and as efficient as possible is really rewarding. Definitely do it, it's really good, you get a lot out of it. It's definitely something, if you don't want patient facing, it's really rewarding because you're still making a difference to people's lives, and yeah, it's really good. MedShed.
Yeah, my name's Mark Beaumont and I'm Head of Sustainability at the Trust. So I got into this area from university really, having an interest in both the environment and energy efficiency, and that's grown over the years to the wider field of sustainability. And I've previously worked both in private sector roles and now in my role at the Trust, where I'm able to do a full range of work involving sustainability. Sustainability is hugely wide-ranging, so it's everything from the food we eat, the energy we use, how we generate that energy, how we travel to work. Basically anything and everything that we do has an impact on the environment, and in some way, either directly or indirectly, emits carbon into the atmosphere. So ultimately, it touches on all areas of the Trust of things we do. I think the solar PV farm is probably the biggest thing that we've managed to deliver. We installed just over 11,000 panels, and they generate a third of the total power requirements of the Castle Hill site every year. We also have a small flock of sheep now on one of our fields, which help to keep the grass down and reduce costs from a maintenance point of view. Some of the key areas of focus at the moment are anaesthetic gases. They have a really high global warming potential, which means they have a big impact on the atmosphere. The diversity, there is a lot of areas. I never knew how interesting anaesthetic gases could be until I started picking that up. The opportunity to work with lots of different people across the Trust, so we work with not only the estates teams, but also the clinicians, our procurement teams, our transport teams, looking at the vehicles we use and how we can encourage people to cycle, do other things. So it's great being able to touch in so many different areas and have lots of different areas of interest. It's a great opportunity for young people to get into sustainability within healthcare. There's now new apprenticeships coming out within the NHS, and there's going to be only increasing demand into this. There's so many fields within the remit of sustainability for people to either specialise in or to become a generalist in. MedShed.
I'm really proud to have started my career in adult social care as a care assistant. I actually had my first job whilst I was studying for my A-levels, and when I couldn't decide which career path I wanted to take, I took a year out to come into adult social care whilst I made that decision, and never left. And so I started working with older people in residential care homes and had the immense privilege to work with people who have shaped the way I work and have also shaped the way I live my life because of their influence on me. I've had the opportunity to do vocational qualifications and also studied for a degree whilst I was working full time, and then ended up working in regulation with CQC, where we were enforcing the regulations that are required around care home and care provider quality. I came to work for North Yorkshire in 2017 and as an assistant director, and this really is a really satisfying role, but nothing beats the reward of actually working, delivering direct care to people, where you can go home at the end of the day, you know you've made a difference to that person's day, you've had the opportunity to either make them comfortable, relieve their anxiety, or just have had time to listen to their life stories and show a real interest in what they do. I'm really...
So, we've heard now from quite a few different speakers there around their different career areas. And again, I mentioned earlier on in the webinar, but just want to flag this up again, that we do have lots of resources and information on our dedicated Health and Care Careers website. The address is on the screen there. So please do take the time to explore the website, look at our career pathways. We've got information on there around education and training opportunities as well. It really is a one-stop shop for all things health and care careers across Humber and North Yorkshire. Another thing I just want to flag up with those of you on the call, if you are living in the North Yorkshire area, our local authority is working in partnership with the Prince's Trust. So if you are aged 16 to 30, they're able to support you with CV writing, training support, interview discussions, team building, and progression and personal development. And there is an email address there on screen if you want to reach out to that team, and the contact is Jenny there. So any questions from the audience now? Let's have a look and see if we've got any questions in the chat. Doesn't look like we have at the moment. Obviously, if anybody does have any questions, please do feel to pop them in the chat. I'll just give that a couple of seconds. And the other thing I've just popped in the chat myself is the poll. So this is a way that we evaluate the programme. There are 7 questions in there, and we do ask that delegates just take a few minutes just to complete that if they can, and that just gives us a little bit of an insight into how you found the session, and it helps us to improve and develop our future webinars. So I will just give you a couple of moments just to fill that in the chat as well. And obviously, if you do have any further questions, you can pop those in the chat too. So that brings today's session to a close. I'd just like to take the opportunity to thank everybody who's attended today. I really appreciate that. We have recorded the webinar, and the recording will be available on demand on our website shortly. So thank you very much for joining today, and I look forward to our future webinars.